All right, hello. My name is Reggie Gilstrap. This is my chest and thorax assessment. All right, here I go. Hand hygiene. Hello, Mr. Gilstrap. My name's Joey. I'll be your student nurse for the day. How are you doing?
Good, how are you?
I'm living the dream, man. All right, so today we're going to be doing a chest and thorax assessment. It'll take about 5 minutes. Is that okay?
Mm-hmm.
All right, can I get your name and date of birth?
Town, Gilstrap, August 30th, 2000.
All right, and do you have any allergies?
No.
Okay, so the first thing I'm going to do is I'm going to look at you, okay? I'm going to inspect your chest. Just look at it. And what I'm looking for is any deformities, okay? I'm going to make sure your breathing is right. Your respirations right now as we're sitting are about at 16 respirations a minute, which is within normal limits, okay? It's symmetrical, you're breathing in and out, and it's at the same rate, okay? It's not, you're not in any distress. You're not using any accessory muscles. You're not like breathing really hard. You're not flaring your nostrils. The way you're sitting, you're erect, so you're not showing signs of labored breathing. Um, the next thing I'm going to do is I'm going to check your lung expansion on the back, okay? So can you do me a favor and stand up, please, and turn around? I'm going to touch you, okay? I'm going to place my hands on your back, and all I want you to do is take a deep breath in and a deep breath out. All right, thank you, sir. You can take a seat. All right, so it was equal on both sides, so it's good, okay? The next thing is I'm going to palpate, so I'm going to touch you, okay, with my hands. And what I'm going to do is I'm going to just look at your chest and touch it, and you're going to tell me if any part is tender, okay? All right. All right. Did any of that hurt? All right. Patient says there's no signs of tenderness. I didn't feel any deformities. I also want to note that the patient's skin tone is appropriate for their race or ethnicity, and I don't see any signs of cyanosis either. So the next thing that I'm going to check is tactile fremitus, okay? So what I'm going to do is I'm going to place my hands on you. I'm going to check the vibrations when you speak, okay? So what I want you to do is I want you to recite 99 every time I touch you, okay? All right, so I'm going to put my hands on you.
99. 99. 99.
All right, can you stand up for me for a second, please? I'm going to do the same thing on the back, okay? Turn around. All right, go ahead.
99. 99. 99. 99.
All right, go ahead and take a seat for me. Thank you, sir. All right, so the next thing, well, first of all, I didn't find any masses, okay? And that wasn't tender at all? So no masses and no tenderness. That's really good. The next thing I'm going to check is your cap refill, okay? I'm going to press on your capillary bed, which is on your fingernail. And I'm just going to make sure that it goes back to color after I press on it, okay? Patient's cap refill comes back within 1 or 2 seconds, so that's good, okay? It's normal. The next thing I'm going to do is I'm going to auscultate. So I'm going to put on my stethoscope and I'm going to actually listen to your lungs, okay? Every time I move it, I just want you to take a deep breath in, a deep breath out, okay? All right, can you stand up for me? Can you turn to your side? Can you raise your arm? This is the right side. You have 3 lobes, okay? So I'm going to check 3 places. All right, can I do the other side, please? All right, and now I'm going to do your back, okay? All I'm going to do is follow right around your back muscle, okay? It's called your scapula. Alright, you can go ahead and take a seat, okay? Alright, so after I got done listening to your lungs, they sounded clear bilaterally, which means across the board they sounded the same, okay? I didn't hear any weird noises, any creaks or anything crazy, okay? Alright, so I just got done doing your thorax and your chest assessment. I just want to let you know that when I did those auscultations, I did that under your clothing, okay? But for the sake of this video, I did it on top. But normally we would do it underneath, okay? And that's just to decrease sound and noise created from clothes or hair or stuff like that, okay? So since we're done with the chest and thorax assessment, I didn't find anything unusual. Everything was within normal limits. Do you have any questions for me? Okay, do you need something to drink or something to eat or a pillow?
Nope.
Okay, so I'll give you your call light. If you need anything, you just call me, okay?
Alright.
Alright, thank you for letting me do this assessment. You take care, okay? Hand hygiene and walk out the door.